another successful lecture today. We had a good group, a full house, and today's topic was really important. It was about furcated teeth and how we design and contour these furcated teeth and how we send them out to the doctors properly contoured so that it's hygienic and correct. And it was a pleasure today to have a good friend of mine, Dr. Michael Zabell, who participated. Dr. Zabell, thank you so much. It was really kind of like an important subject. I think everyone really took well to it, and everyone got on the same page pretty much as to what this was. Thank you for coming. I appreciate it. So just from a dental lab standpoint, why is it so important that as technicians we really understand furcations? It's something that the doctors deal with more. Why do we really have to know the proper contours and how to return these crowns to you correctly?
Well, because the crown has to work with the biology to keep things healthy. If the crown is over-contoured, under-contoured, or improperly contoured, it'll create problems that leads to periodontal disease and possible loss of teeth or loss of restoration.
I know we tackled a little bit about periodontal disease with the staff today. I know that's not always a leading cause of furcated teeth, but we do have to deal with them sometimes. So having the staff understand that is a big plus, and thank you for having us and explaining that whole process of periodontal disease and bone loss to everybody. I know we're dental technicians, but sometimes understanding the biology and understanding what you guys do and why kind of really helps us with that. And so that was a huge plus. Thank you. So Dr. Zabell, I know we talked a little bit about the proper contour on these crowns, and why did we hit home so much today with the technicians about that buccal contour, that furcation that's created on the buccal contour, and having that prepped correctly, and why we have to maintain that and all the way through to the occlusal, and we don't have to make a perfect crown. We have to keep the contours of the furcation. Why do you think that was like such an important thing that we had to hit home with these technicians? What have you seen?
Well, once you get into preparing teeth that have had periodontal disease, even small amounts of periodontal disease, you're not working on the anatomical crown of the tooth any longer. Now you're working on the root surface. And it's important that the crowns fit properly and that they're contoured so that patients can clean them interproximally and on the facial and lingual surfaces. And if the contours aren't followed properly by the dentist doing tooth preparation or by the technician preparing a crown restoration, then it becomes a plaque problem and periodontal disease can ensue. So then the crown would have to be removed and remade. So in order to keep the teeth healthy, contours are very, very important.
We talked today about contours, about why a dentist has to give us the right preparation, okay? And even though we can see the margin, sometimes the axial walls of the teeth are not prepared enough to give us, that create an undercut to give us a space.
The longer the tooth is, the more difficult it is to seat the crown due to hydraulic pressure. So the more taper you need to overcome that. You can't taper the teeth too much because you lose retention, but you have to have some taper, and it has to be such that you can clear the proximal contact points. So tooth preparation is very important.
And one thing we hit home though today about was that buccal furcation, that facial furcation, that deep one on an upper molar. And sometimes that deep furcation is not prepped back enough. Okay, they don't give us enough room to create the proper thickness of a crown and keep the margin intact. So sometimes it's not the technician's fault on how much they can contour correctly. Sometimes they have a tendency to over contour. Talk about that buccal furcation and why.
So when you have a horizontal defect of a furcation, you have to prep it out completely and have to prep occlusally also, so that you can create, the technician has enough space to create a flat emergence profile and have enough thickness of material so that the crown is strong enough
exactly
to work in the mouth.
Yeah. And we really harped on that today. We really talked a lot to the technicians about, hey, we don't have to make a perfectly looking crown. You know, we can make a crown that looks like the prepped furcated tooth. We can do that all the way up to the occlusal surface. That's the correct way to make a crown like that. It doesn't have to be perfect. Usually the technicians here and the designers will make crowns because we work from the tissue up, from the CJ up. But when we're dealing with a furcated tooth, then we have to change that contour, and we kind of design them more to the shape of the prep. It doesn't have to be a perfectly shaped tooth. So.
Yeah, well, I don't like to use the word perfectly. You're
what we're used to. Yeah.
You're making a crown that's not necessarily what you see in picture books. As soon as you get onto the root surface of the teeth, it's going to change the look of the anatomical crown also.
Okay.
And you shouldn't be afraid to do that.
Yeah, exactly. Perfect. So another great lecture series. Thank you so much again for coming. It was great to see you again. Maybe we'll do this again on another subject soon. Come in and see us again. Okay? Thank you. Thanks, everyone.
To receive a copy of this lecture, visit www.rodentallab.com/ROE Reviews.